Hi, I'm Stephanie Pelletier. I'll be your nursing student for today, and we will be doing a full head-to-toe assessment. For this assessment, I have my stethoscope, my pen light, and a pair of gloves. The first thing I will do is perform hand hygiene. Do you use any assistive devices?
Yes.
What do you use?
Contacts and glasses.
Are you using any currently?
I'm wearing contacts.
Patient reports use of glasses and contacts and is currently using contacts for this assessment. I'm going to give you 3 words to remember during this exam, and I'll have you recall them later. The words are flower, chair, and scarf.
Flower, chair, and scarf.
If you feel any pain or discomfort at any point during the exam, please let me know. Are you currently feeling any pain?
No.
Patient reports no pain. Patient's skin is of a normal color. May I touch your arm?
Yes.
Skin feels warm and dry to the touch. May I see your hands? Skin trigger in the upper extremities is good. Cap refill is sufficient, with color returning in less than 2 seconds. Nails are trimmed and well groomed. No signs of clubbing or abnormal grooves. You can put your hands down. We'll now check your feet. Thank you. Skin trigger of the lower extremities is good. Patient is well hydrated. Toenails appear cut and well groomed. No signs of clubbing or abnormal grooves. Capillary refill in the lower extremities is sufficient, with color returning in less than 2 seconds. You put those down. I will now assess the head, neck, sinuses, and lymph nodes. Patient's head is of normal size and shape, with features symmetrical on the face, and the head is erect centrally on the neck. I will now palpate the scalp. Ensuring to put on gloves. May I touch your scalp?
Yes.
Hair is blonde and well distributed, cut short. No alopecia or infestation appears present. No abnormal masses are palpated. Did you feel any pain?
No.
Patient reports no tenderness upon palpation. May I lift your chin up? Patient's facial hair is also blonde and well groomed. I will now assess your jaw. May I palpate along your jaw?
Yes.
Tell me if you feel any pain or tenderness. Perform a chewing motion for me. Okay. No jaw cracks are present. Patient reports no pain or tenderness. No TMJ is present. I will now check the maxillary and frontal sinuses. Sinuses do not appear swollen. May I palpate your sinuses?
Yes.
Do you feel any pain or tenderness?
No.
Patient reports no pain or tenderness. Upon palpation, no signs of swelling in either the maxillary or frontal sinuses. I will now check your lymph nodes. May I palpate your lymph nodes?
Yes.
Did you feel any pain or tenderness?
No.
Patient reports no pain or tenderness. No swelling was found upon palpation. I'm going to check your trachea. May you lift up your chin. May I touch your neck?
Yes.
Trachea is at the midline. Do you feel any pain or tenderness?
No.
Patient reports no tenderness, no abnormal masses are found. Do you have any difficulty swallowing?
No.
May you swallow, please? Swallowing is intact. We're going to do range of motion of the neck. Can you turn side to side, up and down? Patient has full range of motion in the neck, no signs of crepitus. I will now palpate the thyroid. You lift up, may I palpate your thyroid?
Yes.
Do you feel any pain or tenderness?
No.
Patient reports no pain upon palpation. Thyroid is not palpable. I will now assess ears, nose, mouth, and eyes. Do you have any difficulties hearing?
No.
Any recent changes in hearing?
No.
Patient reports no difficulties or changes in hearing. I will perform a whisper test where I will whisper a word in each ear. I would like you to repeat the word back to me.
Hello. Hi.
Patient passes a whisper test and has no difficulty hearing. I will now inspect your ears. Turn. Okay. No drainage is visible. May I palpate your ears?
Yes.
Did you feel any pain?
No.
Patient reports no pain upon palpation. No abnormal masses were palpated. I'll move on to the nose. Patient's nose is at midline, symmetrical on face. Do you have any changes in smell?
No.
Any difficulty smelling?
No.
Can you block one nostril and breathe through the other? And the same on the other side. Patency of the nares is intact. May I look in your nose?
Yes.
No visible drainage or swelling is present. Now with the mouth, have you had any difficulties with taste?
No.
Any changes in taste?
No.
Okay, patient reports no issues with taste. Lips are pink. No signs of edema or cyanosis. May you open your mouth for me? Mucous membranes are pink and moist. No odor is detected. Teeth are white with no signs of plaque buildup. Can you say it with your tongue? Tongue is pink and moist with no signs of plaque buildup. Say ah. Uvula is at midline. Tonsils are visible but not swollen. I will now move on to the eyes. Eyes are symmetrically placed bilaterally on the face. No visible signs of drainage or irritation. Eyelashes and eyebrows are appropriate, well distributed. Sclera is white and clear. Irises are normal and of the color blue. May I pull down your lid? Conjunctiva is pink with no signs of drainage or swelling. Pupils are round and equal bilaterally. I'm going to test accommodation. Please follow this pen with your eyes. Pupillary accommodation is intact. I will now be testing reaction to light. I will be shining the light in your eye. Is that okay?
Yes.
Okay. Just look at my nose. Pupillary reaction to light is normal. I will now test vision. Can you follow this pen with your eyes and not your head? Six cardinal fields of gaze are intact. I'm going to test peripheral vision. Can you tell me when you see my fingers?
No.
Patient peripheral vision is intact. I'm going to ask you a few questions. What is your name?
Matthew.
Where are you?
Your apartment.
Who is the current U.S. president?
Barack Obama.
Patient is alert and oriented ×3. Speech is clear. I'm going to test your nerves. Can you push up, shrug your shoulders up? Good. Now smile, frown, pucker cheeks, and wiggle your eyebrows up and down. Good. Patient's spinal accessory nerves and facial cranial nerves are intact. Can you please stand up for me? Can you touch on both hands, touch the tips of your finger, each finger to the tips of your thumb? Very good. Patient's fine motor skills are intact. Now can you slide the bottom of your foot up and down your shin on each leg? Patient's gross motor skills are intact. I'm going to have you close your eyes. I'm going to touch a part of your body. I would like you to tell me out loud the name of the location I touch. Are you ready?
Yes. Right shin. Left hand. Right shoulder. Left cheek.
Okay, you may open your eyes. Patient sensation is intact in all areas. Can you please walk normally to the wall and then stay there? Patient gait is normal, no signs of limping. Posture is erect. Balance is intact. Now can you walk back with one foot directly in front of the other to right in front of me? Okay. Now I will have you touch the tip of your finger to the tip of your nose and then touch my finger. Ready? Very good. Patient's coordination is intact. Okay, we're going to test range of motion in your arms. Can you rotate each shoulder for me? Good. And now the other one. Good. Okay. Can you bend this elbow? You rotate this wrist. Okay. Bend this elbow. Rotate your wrist. Okay, you may put your arm down. Range of motion in upper extremities is within normal limits. No signs of crepitus. Put your arms out. Push up against my hand. Push up again, down against my hands. Squeeze my fingers. Patient's strength in upper extremities is within normal limits. Can you swing this leg from the hip, forward and back? Good. You can put it down. Now this leg. Good. You can put it down. Can you turn around for me? And bend over with your back arched. May I touch your spine?
Yes.
Patient's spine has a straight alignment with no curvature or signs of scoliosis. You may stand. Did you feel any pain or tenderness?
No.
Patient reports no pain and tenderness upon palpation. No abnormal masses were found. You may sit down. I'm going to finish testing range of motion in the legs. Can you bend this knee? Then bend this knee. Can you rotate this ankle? Wiggle your toes. You can put your leg down. Rotate your ankle. Wiggle your toes. You may put your leg down. Range of motion in lower extremities is within normal limits. No crepitus is present. We're going to test strength. Can you push with your feet up against my hands? Now push down against my hands. Push up against my hands. Very good. You may put your legs down. Patient's strength in lower extremities is within normal limits. I will now assess the patient's chest. Chest appears of normal size and shape. No barreling or pigeoning appears present. I will now palpate the chest to feel for the precordium or any abnormal masses. May I palpate your chest?
Yes.
Did you feel any pain or tenderness?
No.
No pain or tenderness reported by the patient. No thrills or flutters were detected, nor were there any abnormal masses. May you turn this way for me? I will now test chest expansion. Please breathe in and out deeply. And stay in this position. Chest expands symmetrical bilaterally. I will now auscultate posterior lung sounds in both the right and left lung fields. When you feel my stethoscope, please take a deep breath in and out. You may turn and face me. Patient had normal lung sounds in the right and left posterior lung fields. No bronchi, crackles, or wheezing were heard. I will now listen to the lung sounds of the anterior right and left lung fields. Anterior lung sounds are normal. No wheezing, bronchi, or crackles are heard. I will now auscultate heart sounds. I will be listening to aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm switching over to listen with the bell of the stethoscope. Okay, patient's heart sounds are normal. Rate and rhythm is normal. No murmur or arrhythmia detected. S1 and S2 are present. I will now palpate the peripheral arteries, starting with palpating and then auscultating the carotid arteries. May I touch your neck?
Yes.
Carotid arteries are palpable bilaterally with a strength of 2+. Rate and rhythm are normal. Sound is normal. No bruits or wishing were heard. I will now palpate the radial arteries. May I see your wrists, please? Thank you. Okay. Radial arteries are palpable bilaterally, 2+, normal rate and rhythm. I will now palpate the posterior tibialis arteries. Can you put your feet up? Thank you. Okay, posterior tibialis arteries are palpable bilaterally, 2+, normal rate and rhythm. I will now palpate the dorsalis pedis arteries. You may put your feet down. Dorsalis pedis arteries are palpable bilaterally, 2+, normal rate and rhythm. I will now assess abdomen. You may lay down with your head on this end. May I lift your shirt?
Yes.
May I touch your abdomen?
Yes.
Skin of the abdomen is of normal color. Skin feels warm and dry to the touch. No visible signs of ascites. I'm going to palpate the abdomen for any abnormal masses, bladder distension, or abnormal swelling. May I touch your abdomen?
Yes.
If you feel any pain, tell me. Or tenderness. Did you feel any pain?
No.
Patient reports no pain. No bladder distension, abnormal swelling, or abnormal masses were palpable. Excuse me. I will now listen to bowel and vascular sounds in each of the 4 quadrants. Stethoscope may be a little cold. You may pull your shirt back down and sit back up. Patient has normal bowel sounds in all 4 quadrants. No hypo or hyperactive bowel sounds were heard. Patient is negative for vascular sounds. And that is our assessment. Wait, what are the three words I had you remember from the beginning?
Chair, scarf, and flower.
Patient's short-term memory is intact. Now, that is our assessment. Thank you very much.